many businesses would absolutely be delighted, overjoyed, if the government would take their healthcare responsibilities off their books. Many others would suffer. It depends on the composition of your workforce. It depends on how high the taxes are going to be. But the problem of providing universal care is, I would say, problem number 2 when we think about the healthcare crisis in the United States. Problem number 1 is slowing the rate of healthcare inflation. First, because if we can slow the rate at just between 2000 and 2006, a health insurance policy for a family of 4 doubled in cost. It went from $6,000 to more than $12,000. Well, if it had gone from $6,000 to $8,000, the whole problem of the uninsured would be a lot worse. I mean, when you double the cost of things, the number of people who can pay that cost, the number of people who cannot afford to pay that cost rises very rapidly. If we could slow the rate at which these costs are rising, we would also slow the rate at which the people who can't afford these costs is rising. I believe as well that the healthcare problem, the problem of insurance, is very connected in the United States to the problem of migration. That when you, as the United States has done since 1970, import 35 million, or actually closer to 40 million people, almost all of whom are very poor and with very low levels of education and productivity, and whose employers therefore don't think it worthwhile to provide health insurance to them, it's not a surprise that the proportion of people in your society without health insurance should rise so rapidly.